I thought about, what am I passionate about? I like evidence-based medicine, so I thought about doing a talk on that. I thought it'd be a little bit dry, and I just kept putting it off. I wasn't sure what to talk about exactly. Kept procrastinating, had a few ideas in my head, but ultimately, again, just kept putting it off, like in this little comic here. A couple weeks ago, though, I finally had an idea. Anyone watch Rick and Morty?
Yes.
Yes. Okay, so they actually had an episode this season that actually kind of illustrated how I was feeling at the time. Let's see if this works. Survey on burnout and essentially and depression. We are number 6 on the list, but not too far behind. The top one's right there. Some quick facts about burnout. So the peak age is actually around 45 to 54 years of age. So that's just a good reminder for us to think about our attendings, right? They're the ones who are really feeling a lot of burnout, despite the fact that we are working longer hours. And obviously the job that we work is the highest contributor to burnout. As residents, we don't really have too much control over that, unfortunately, right? So in talking about burnout, I want to talk about what are some of the modifiable risk factors. What can we actually change, right? So let's start thinking, what about this? What about our social lives? This was the 2016 Medscape resident wellness and happiness survey or something like that. So obviously, not a lot of us feel like we usually have enough time for satisfying social life. And there was a small Canadian study that looked specifically at residents. They found that once they had an erosion of their personal relationships, it led to burnout, and a lot of times that burnout would force them actually further into the field. Kind of as a reflex, they would retreat back into medicine, causing a little bit of a vicious cycle of burnout and decreased personal relationship satisfaction, things like that. So obviously social support is important, right? Loneliness is associated with burnout. Poor support is associated with depersonalization, lower personal achievement, and increased emotional exhaustion. There was a systematic review from Germany. Interestingly, they found that females benefit more than males from social support. So as I looked at all the issues surrounding burnout, I want to talk about certain practical tips and things that we can focus on as residents. Today is Valentine's Day. Does anyone know who this is?
St. Valentine's.
St. Valentine's. I don't know the story of St. Valentine.
He killed him.
No. So he wasn't a saint back then. He was just some guy in the Catholic Church. Pius II decided, you know what? I don't want any of my soldiers getting married because that makes them weak. I want strong soldiers. So he outlawed marriage. But Valentine over here is like, screw that. All right, people are in love. I'm going to marry them anyway. So he would marry people in these, secret ceremonies. When Claudius finally got wind of that, he had him arrested and he sentenced to death. And as the story goes, apparently his jailer had a daughter who was blind, and he brought his daughter to Valentine, and was like, "Can you please cure her?" So he apparently laid his hands on her and cured her of her blindness. And when she saw for the first time and saw his beautiful face, they fell in love. And shortly before he was to be executed, he wrote her a letter, a love letter, obviously, and ended with "From your Valentine." And apparently that is how Valentine's readings and things like that are around.
In blood, right? In blood. You wrote it in blood.
If you say so. All right, so I'm going to talk about love. All right. This is obviously a topic that I know a lot about. You'll notice I've kind of peppered throughout my presentation pictures of my class. This is actually a picture of Ben from when he was in Haiti. And because I like, evidence-based medicine and I'm a little bit scientific, we're going to define love. We're going to go through the epidemiology, risk factors for love, physiology, some of the benefits and complications. We're going to talk about how it intersects with medicine and pertains to us specifically, and then some alternatives, right? It's not for everyone. What is love? So, what is love? Alright, so, anyone want to try to define love for us? No takers? What is love? That's a good question. So, the Oxford Dictionary defines it as an intense feeling of deep affection or, intense personal interest in something. All right, simple enough. So, epidemiology. I really like Sally's face in this. Crap, right here. Oh, there we go. All right. All right, so I also have some candy. If you guys are able to correctly guess the quotes where I'm putting some famous love quotes. If you guys can correctly guess it, I'll give you some candy at the end of the lecture, all right? Does anyone know this one? No. False. It is a song.
Yeah, it's definitely a song.
Does anyone know who sang it? Very good. Do you know the artist? All right. It's Tanto, Metro, and Devante, guys. All right, so this is a Gallup poll in 2016. Looked at kind of statistics of marriage, comparing the different generations. Interestingly, they found that not only are millennials delaying marriage, they're also obviously choosing kind of some alternatives. Domestic partnership rates have been going up, and if you compare the same age that all the different generations took the survey, 27% of millennials were married, compared to 36% of Gen Xers, 48% of baby boomers, and 65% of traditionalists. So obviously, again, we're delaying marriage as a generation. All right, so pathophysiology.
Eden, that graph is skewed, right? Because our Gen X hasn't had time to get married.
So that graph was now, but then they also compared at the same age. That everything was done as well. All right, so does anyone know what the animals in the top left or the bottom right are?
Prairie voles.
Prairie voles, very good. So these are prairie voles up here, and those are montane voles. Does anyone know what the difference between the two are?
The expression of oxytocin and pair bond rate.
Yes, so prairie voles, I don't know why you don't know that. You're going to get some candy just for that. So prairie voles are who scientists study. Apparently, genetically, they're almost identical except for one tiny little change, but it creates a huge difference in their social behaviors. For instance, prairie voles are monogamous. When a prairie vole finds a prairie vole female, they have babies and they're bonded for life. Whereas montane voles, when he finds a female, they have sex. Once she's pregnant, he's gone. He's gone. Completely different behavior. So there have been a lot of studies looking at them, and this is how they kind of found the role of oxytocin, vasopressin, and the dopamine reward system in love and pair bonding. They also found some overlap on fMRI. I don't know how they put these tiny things in fMRI, but they did. And they do think that females actually respond a little more to oxytocin as opposed to males who respond a little more to vasopressin. But obviously love is not so black and white and easy to study. There are a lot of hormones involved as well, serotonin, cortisol, and testosterone. Apparently when you're in the early stages of love, your cortisol levels are increased, heightened anxiety and stress. But as men are further along their relationship, their testosterone levels kind of drop, whereas for women it increases. But a lot of these hormonal changes change over time. And a lot of times they actually disappear altogether. All right, there are obviously some benefits to love, right? They took at a lot of weird studies. So this is a thermo that they use in a lot of studies looking at painful stimuli. So they took a lot of women that were in long-term relationships, at least 6 months, and they applied a painful stimuli while they were looking at a picture of their loved one or holding the hand of their loved one. They actually found decrease in their perception of pain when they're looking at the picture of the loved one. They also looked at just having a picture of their loved one, and then they looked at fMRI and activation of pain centers in the brain, and found decreased activity when they had longer relationships and perceived partner support as well. So obviously pain can be lowered by feelings of love and social support. Another interesting thing is what's called loving kindness meditation. This is kind of where you meditate on feeling loved and giving love to others. So you have like a mantra like, I love everyone, I love everyone. Keep repeating that. And everyone loves me. So when people do this, it actually has decreased anxiety, depression, pain, and also it's been shown to decrease the negative symptoms of schizophrenia with increased feelings of well-being. Sounds a little silly, but it's not even worse. All right, what about this one? Yes, I just rickrolled everyone. All right, so marriage. There was an HHS report looking at the effects of marriage on health. They found that it's associated with less heavy drinking and drug use. You're more likely to have health insurance, less depression, fewer colds, and faster wound healing if you had a supportive marriage. If you did not have a supportive marriage, you had delayed wound healing. And also increased survival. So on the flip side, what happens if you get divorced? So divorce is actually associated with increased cardiovascular risk mid to late life in men and women, but apparently the risk is worse for women. But if you never get married, you have the same cardiovascular risk as people who are continuously married. Just some food for thought there. All right, so complications. Now we're going to talk a little bit about what happens when love goes wrong. I have the whole song. All right, so back to marriage. Now, marriage isn't all roses sometimes, right? They did a study looking at EM residents specifically with a significant other or spouse, and it was actually, they actually found that these residents had a higher level of burnout than ones that were single. Marriage is also associated with a more sedentary lifestyle. As you can probably see. All right, so we're going to switch gears a little bit, and we're going to talk more about the medical complications of love. All right, what is this one from?
Bonnie Tyler.
Bonnie Tyler, yes. All right, so what does this EKG show? So this totally normal. This is a STEMI, right? So heart attacks are kind of a known complication of one of the physical manifestations of love. Right? Okay. So next, where is this one from? Anyone? Joy division. Very good. All right. What do we have here? Yeah. So there's a study, it was a single center study, 465 patients who had type A dissections that actually got operated on. So these are, the sicker patients with dissection. They found that fully 11% of men less than 60, their onset of pain was during sexual intercourse. So that's why it's always important to ask, what were you doing when your chest pain started? And no females actually had that same risk factor. All right, what's going on over here? Right, another possible complication. Tony Braxton, very good. Man, everything came. All right, we're going to start with the case. So we've got a 30-year-old Japanese female comes in with crushing substernal chest pain. Okay, all right, good. Now you ask her, what were you doing when the chest pain started? And she says she was reviewing some charts and noticed that residents were not doing or getting any lactates. And she just felt so depressed and sad over this that she started having this chest pain. And this is her EKG. Very, very significant. So obviously you call a code H or STEMI or whatever we're calling it these days. She gets whisked to the cath lab. You see the cardiologist a few days later and you say, you know, how's the patient doing? And she says, you know, no lesions actually. It was very interesting. But the left ventriculogram showed this.
Octopus.
Yes, Takotsubo, yes. So the most widely accepted diagnostic criteria for Takotsubo is from the Mayo Clinic. It seems very long, but it's the main thing is you have to have a regional wall motion abnormality that doesn't fit a single coronary distribution. Also, no obstructive lesions, either new EKG abnormalities or positive troponins, and not due to a pheochromocytoma or myocarditis. The theory is that it's caused by essentially like a toxicity of norepinephrine and epinephrine, and it causes, and no one knows why, but it causes these regional wall motion abnormalities. So there are actually 4 subtypes of Takotsubo. The most common one is the apical one with the classic apical ballooning. The part in red there is the area that's not moving, and the parts in red on the side is where you're having the normal or hypercontractile areas. So that's the apical type. Next is the midventricular type, and they're named by the type that doesn't move. Basal and focal, which are very infrequent. So how do we really diagnose that? It's hard for us in the ED because a lot of times these will be caught in the cath lab, but if we do a good echo, a lot of times we can actually diagnose this as well. Does anyone know how to manage this Takotsubo if we were to diagnose it? Yes. What else? Medically. Well, essentially, if they come in presenting with a STEMI, right, because that's kind of the most common presentation, similar to ACS or CHF. So if they come in presenting like a STEMI, you're going to do all the things you normally do. They just don't need to be continued on blood thinners or antiplatelet therapy. And anyone who comes in with chest pain, ideally, we would throw the probe on them and take a look at, you know, their EF and all of that, right? So this is the EPSS, the E-point septal separation. This would be like a normal one. So let's say you had a patient with Takotsubo cardiomyopathy who comes in presenting with CHF, right? They say, you know, I just found out my loved one died, and then I started having chest pain, started feeling short of breath. Throw the probe on them. There's B-lines everywhere. You throw nitrates, BiPAP, and then they start crashing really fast. Their blood pressure starts tanking, O2 sats dropping. What would you do?
Pressors and Fentanyl.
Okay, so you start some pressors. Which pressor do you want to start? Now they arrest. Now what do you do? ACL. So the reason I'm asking is because Takotsubo cardiomyopathy, you have to think of it kind of like POCM because you can have dynamic LV outflow tract obstruction. So if you drop, so in a lot of sense, they are preload dependent. So if you drop their preload too much with the nitrates and the BiPAP, you can actually cause them to go into a dynamic outflow obstruction and restrict their outward flow. So if you start pressors on these patients, you're actually going to make the obstruction worse. So it's a little bit counterintuitive, but for those patients, you need to actually give gentle hydration and beta blockers. Very hard to do, you know, in the spur of the moment when you have a crashing patient. That's why if you suspect it, you should get cardiology involved. And throw the probe on them. If you see this on your EPSS, this means they have a left ventricular outflow tract obstruction. So, so this is SAM, also known as systolic anterior motion. This is the mitral valve going up and hitting the septum, and that's the obstruction that we're talking about. And this should be the normal E wave, right? So if you see the mitral valve open here during systole, that's bad. And this is the kind of patient that you would probably start beta blockers on and kind of tank them up a little bit. So I would recommend esmolol for this because it's easily titratable and short acting just in case, you know, things don't go well. All right, moving on. Yeah, STDs, right? Everyone knows it's a risk factor. But just interestingly, over the last few years, there's been increases after years of decrease in the STD rate. And a lot of it is, in the public health community, is attributed to things like Tinder, Grindr, OkCupid. Those are the ones at the end of the article. Are there any other STDs that we often don't test or think about that maybe we should? Syphilis, yes.
Yeah, trigger.
Tract, HPV.
I saw Shankroyd the other day.
Shankroyd. Oh, by the way, this was news to me, but apparently New York State is number 5 in the country for primary and secondary syphilis in terms of incidence. So we're doing well, right? But you guys mentioned some great ones, but there's one STD that we did not mention, and it's potentially the deadliest.
Pregnancy?
Yeah. Very deadly. Anything else? HIV, okay. Still haven't mentioned the big one.
Works?
This is a clue. You're gonna lose, yes. Ebola. Apparently Ebola is a sexually transmitted disease. Zika, true. I think Ebola killed a few people though. All right. So now let's talk about the intersection between love and medicine. So, quick review. We talked about love, some theories behind the physiology, the benefits of marriage, love, some of the problems that can arise. It seems like mostly from sex. It seems. Now let's talk about how do we as physicians find and manage love, right? It can be difficult, especially as a resident, right? Sometimes it's just you have so much to do. You're working. You don't have time to hang out, and it seems like an impossible task, right? When you have a string of nights, when you come home, you're exhausted. How are you going to find someone new to but with enough dedication, hard work, some creativity, even residents, all right, so we're about to start. Alright, so these 4 scrappy young gentlemen, all of them got married in residency. So they all found love in a hopeless place. So I want to open this part up kind of for discussion and I guess maybe some commiseration. So where did you guys find your partners?
Swipe right.
JD, sure, great actor. Right? Do you guys even believe in monogamy? Like, is this right? I mean, that's a fair question. Does anyone want to talk about some of the difficulties they found, in residency in finding love?
I would say to the comment about the increased burnout with married residents, if I didn't have my wife in my life, I think my burnout would be through the roof.
Yeah, me too. I agree.
It just doesn't come back to that. But I know you read about that. That's my own personal.
Where's the camera? It's on.
I think, yes, very, very important. But as a single person, right, sometimes it may be hard to find what you're looking for there, Any tips for the single people out there?
Hire someone.
All right, so what do you guys think? Is another physician desirable for a long-term relationship? If you say yes, raise your hand. That is quite the minority. And then I guess everyone else is a no? No. All right, so this question was posed by Medscape, and their results found 51% no, 49% yes. So what do you guys think the divorce rate among physicians are? 60. Yeah. All right. So, contrary to what a lot of people say, the divorce rate is actually really hard to quantify people, they get married over, 60 years, they get divorced once, and then, or maybe multiple times. So it's really actually hard to quantify how many people are divorced at any given time, apparently. But what they did find, they looked at a study of physicians and their divorce rate compared to other professionals, and it was actually less. So we are divorced less than dentists, lawyers, I forget who else was in that group of professionals. But what they did find was that female doctors actually had a significantly higher divorce prevalence than males, unfortunately. All right, so now, I promised I'd have some take-home points for you guys, so hopefully they'll be somewhat enlightening. All right, get married. Sounds like it's pretty protective, right? There's good benefits to it. What about this little quote here? So there's actually an article recently by another doctor essentially telling all female doctors to get a prenup. Like we saw in some of the statistics, it seems like female doctors have a higher divorce rate than male doctors do. And a lot of times, female doctors are less likely to marry physicians and more likely to marry someone with a lower income. Apparently, this is just what the article is saying. And as a result, you should protect your assets as a female doctor and get a prenup. All right. What about this quote? Beetle, yes. So invest in social capital, right? Social support is very protective from burnout. Increases your wellness, right? So they looked at a study from Australia. It was like a large population-based study, and they found that those with good social support from friends lived longer. It didn't matter. Apparently, children don't help you live longer. Neither do the number of relatives you have. But good friends will make you live longer. Loving kindness meditation, right? There's good data for it. It's relatively harmless, it seems. You might feel a little silly, but why not, right? And swipe safely, right? There's a lot of medicine like this. It's only good like 20 minutes talking about how it can kill you, but. All right, what about this song? DMX. All right, so what about if none of the above options feel right for you? So there's a lot of evidence actually that shows that dogs, when exposed to humans, they release oxytocin very similarly to humans. And in fact, they looked at people gazing into the eyes of their newborn child, and they had the same response looking into the eyes of the dog. Right? This is real stuff. Also, decreases your cardiovascular risk factor having a dog. Cats, on the other hand. So they studied cats and whether or not their interactions with their owners quantify as a secure attachment, like babies and dogs. Apparently it doesn't. They don't care if you're there or not. Also, there's some studies showing that you have increased mortality and cardiovascular risk if you own a cat. Obviously, there's toxoplasmosis, and it's also associated with maternal and pediatric obesity.
This is a dog or a cat lover, though, because like there's
It's impossible to say. I don't know. And just as a side note, so that Class 2B recommendation is actually from the AHA. So some other examples of Class 2B recommendations from the AHA. If you have less severe chest pain symptoms, you can go to the ED. Everyone does that. Right? If you have a CHAD-VAS 2 score of 1, you can either treat, give antiplatelets, or give Coumadin. So literally, right? Or consider bare metal stents in patients with bleeding risk. So these are all reasonable things, right? All right, so get a dog. All right, so this quote is it's Dr. Seuss. How do you know this? All right. So this is my personal feelings, right? I think love is all about finding that person who kind of like annoys you the least, right? And you can imagine spending the rest of your life, sitting on the couch and getting fat with, right? And still be happy, obviously. That's the goal. Some people, they'll find that person, they'll find that weirdness. Other people, no big deal. Right? If you're really weird, sometimes you just have to get a cat or a dog, All right. Special thanks to the best class ever, obviously. Also, thank you to Dr. Smith for helping this. I know she was very afraid that this was going to be a disaster. the faculty. I am who I am because of you guys. We have some great role models among our faculty, and I'm really blessed to be here. These are my references. Thank you very much.